Hi, my name is Jessica Gong. I'm a CNTR PhD candidate at the George Institute for Global Health. Today, my topic is on sex differences in the association between major cardiovascular risk factors and dementia. So these are some of the results from the UK Biobank. A bit of background to start with. In 2016, more women died from dementia than men, and age standardized global prevalence was also 1.17 times higher in women than men. These are based on the global burden of disease estimations. In addition, women also bear the brunt of caregiving responsibilities for people with dementia more than men. So as we all know, currently there's no disease-modifying therapy for dementia. So prevention by modifying the effective risk factors so that we can delay or slow cognitive decline and the onset of dementia is key. So in 2020, the Lancet Commission identified 12 potentially modifiable risk factors for dementia. In 2019, the WHO also released a set of guidelines for risk reduction of cognitive decline and dementia. So here today, I'll present some of the results from the UK Biobank for identifying risk factors. So the UK Biobank study included more than 500,000 participants aged between 40 to 69, recruited from the UK between 2006 and 2010. And the study outcome considered was all-cause dementia. And the risk factors considered at baseline were included blood pressure, body adiposity, smoking status, diabetes, stroke, socioeconomic status, and also lipids. The aim of the study is to understand is there any sex difference in the effect of common cardiovascular risk factors for dementia. So by doing that, we estimate the sex-specific hazard ratios for each risk factors using Cox proportional hazard regression, and also estimate the woman to man ratio of hazard ratios for sex comparison. So our study baseline, the mean age was 56.3 for women and 56.7 for men. We excluded people with prevalent dementia. And after a median of 11.3 years follow-up, 2,021 men developed dementia and 1,680 women developed dementia. So here's a forest plot summarizing the findings of from the study. So as we can see here, smoking, diabetes, some measures for body adiposity, stroke, socioeconomic status, and were all associated with a greater risk of all-cause dementia, similarly for men and women. But we can see that the direction seems to appears to be different for women and men in terms of hypertension stages. So we decided to investigate this further using spline analysis. If we focus on the spline for systolic blood pressure, we can see that it's a dose-response relationship for women, but it appears to be a U-shaped relationship for men. And this is really interesting, and here are some of the protective mechanisms such that women have been improved cerebral autoregulation than men, and hence reduced level of autoregulation may cause hypotension, leading to hospitalizations, and low blood pressure may be related to dementia as well. So sex differences in medical treatments are also possible. So previous studies actually reported treatment adherence was generally lower in men, and which may be compounded by polypharmacy and more side effects in women. So potential implications of our study, risk reduction through modifying risk factors may alleviate the burden associated with dementia. And policy interventions to address the social dimension in dementia risk is also important, given that we have seen that socioeconomic status was significantly associated with all-cause dementia. Bespoke blood pressure lowering trials are also necessary to understand the role that blood pressure plays in attenuating cognitive decline. And in addition, such trials should be designed in a way that to include an equal number of women and men so that these potential sex differences can be further clarified. Here I present the project team. So Dr. Katie Harris, Professor Sana Peters, and Professor Mark Woodward were all at the George Institute for Global Health. So some references. And thank you. If you have any questions, please don't hesitate to email me here. Thank you.